my question would be is like if another proposal comes to you on your table, like similar to, oh, let's say Sam Ricardo,
Yeah.
and say, please, may I work with the police. How would you both looks like? Good afternoon. My name is Omar. I'm here with Supervisor Susan Ellenberg, and also we have Claudia Rossi. Claudia is a registered nurse, and also she ran for supervisor last elections, right? Thank you, Rossi. Thank you, Supervisor, for taking this interview.
I'm
Uh,
glad to be here, Omar.
Thank you very much. Well, so what we know right now is that this HR1, for people who doesn't know what it is, this is the big, beautiful bill for Donald Trump that is cutting a lot of money for the counties, for states, everything. And Santa Clara County is being affected, especially the hospitals and traumas and emergency rooms and overall the hospital, I mean, different sectors in the hospital are being affected. But in last minute, the county, the board of supervisors decided to put a proposal, which is a sales tax increase for fifth, eighth of a dollar. And this is, can you give us an overview what this proposal is and what this is supposed to do? Please, can you explain us?
Absolutely. If it's okay, I'll start by backing up a little bit to HR1. HR stands for House Resolution, and that's just the number that the bill was given um, in order to go through the legislative process. Yes, Trump calls it the big, beautiful bill, but it really is a huge disaster just around the corner waiting to happen. HR1 makes significant cuts to many, many services, social services that folks all across the country rely on for healthcare, for food access, for housing supports, for public health. This bill is basically directed at making life even harder for people who are poor, people who are already struggling. County government is responsible for providing most of those services. We are the safety net, and our responsibility is to take care of people who are, for a variety of reasons, not able to thrive in our community without some additional support. Something that is, so that's happening in counties across the country. A piece that is unique in Santa Clara County is that we operate a very large public health system. In fact, it's the second largest in the state after Los Angeles. And our public health system consists of 4 hospitals, 15 county health clinics, and then a number of other community clinics that we provide some funding for. Of our budget, which last year was about $12 billion, and I know that sounds enormous, but almost all of those dollars have to be strictly spent on some specific thing. About $3 billion is what we have received in the past from the federal government to reimburse our hospitals and clinics for care that's provided to people who receive Medicaid or Medi-Cal for their health insurance. When this horrible bill was passed, it put into place a series of reductions to that Medi-Cal, Medicaid coverage that are going to impact people who receive Medicaid, but they are also going to impact other people in our community, because what will happen is that as we get fewer dollars from the federal government to reimburse for healthcare, we're going to have to take other money from our county budget to backfill those expenses. which means less money for other vital services in our community. It really is an existential challenge for our county right now. So you ask about the timing and you use the words last minute. The bill was just passed, I believe, in May or June. The county government takes somewhat of a recess during July. And at our very first meeting in August, when we came back, in fact, we scheduled a special meeting prior to the regular first meeting in August, specifically so we could consider putting a tax on the ballot. We had to do it that quickly because our county is going to have a special election this November due to the early retirement of the county assessor. The county assessor was elected 2 years ago. His term should end in 2026, but because he retired early, the county by law is required to hold an election this November. So we wanted to make sure that this sales tax measure would make it onto that same ballot so that we wouldn't have to wait until 2026.
Um, Rosie, do you have a question for Supervisor?
I do, Supervisor. What would you say to members of our community who have Kaiser insurance, who have their private insurance? Why should they care about the fiscal health of a county hospital? And there are community members who feel that way.
Sure. So there are a lot of reasons. We can look at people with private commercial insurance, Kaiser, even Medicare. What happens in hospitals is that they charge insurers for the price of caring for patients. When when the Medicaid dollars are reduced, which means less money will be reimbursed, hospitals are going to look for other sources to build up that revenue because they are still required, even Kaiser, Stanford, Good Sam, they are required to see any patient that walks into an emergency room. And a patient who has received Medicaid, who no longer has it, no longer can go to a doctor or receive primary care without that insurance, but they can always go to an emergency room. So we are going to see more and more patients going to emergency rooms, which number one will create longer waits, not only at the public hospitals, but at the private. And we are going to see rate increases at the private hospitals to compensate for the lost dollars. And who is going to pay those increased rates? The private insurance companies will turn to their customers and charge them more money so that they can pay the higher rates to the hospitals. Everybody passes on the dollars. Another challenge and why people should care is that access may be diminished. If enough patients lose their health care and a hospital census is decreasing, they may decide to close certain services, just as Regional Medical Center did, if those services are not drawing in enough money. So as services close at private hospitals, the access to care diminishes. The only reason that our county owns 4 hospitals is because the private commercial healthcare industry did not believe that it was profitable for them to continue to operate. We had no desire or vision of becoming a major healthcare provider. But if you'll recall, in 2018, I believe it was a hedge fund, Verity, that owned O'Connor and St. Louis and some other hospitals went into bankruptcy. Our county was the only entity that made a bid to buy O'Connor and St. Louis. We closed that sale in, I believe, April of 2019. Imagine for a moment that those hospitals did not exist 13 months later when the pandemic began in earnest. We bought Regional Medical Center because our 3 hospitals at the time, we had 3, were nearly at capacity. We were starting to see longer waits, and Regional Medical Center was closing department after department, first labor and delivery, and then comprehensive stroke services, and then the highest levels of trauma and heart attack services. Those patients were coming to our hospitals, to the public hospitals, and straining our systems. So purchasing St. Louis Hospital, Regional Medical Center essentially became a cost savings measure because we're going to be treating those patients anyway. And we are not interested in making a profit. We are interested in providing health care. It's also important to point out that when we bought those 3 hospitals, we did not come to the voters for additional funding. That is really significant. Our business model could sustain the addition of 3 new hospitals without additional funding. We did not overinvest in the healthcare system. We did what we could manage. What has fundamentally changed is the sweeping changes to Medicaid that are so much larger than anyone could have anticipated. That has been the change in the financial situation, and that is what is causing us to need to go to the voters now.
Supervisor, I have a question about, because this is, just people understand, this is not an amendment to the California Constitution, right? So it doesn't need like 60-something% of the votes. It only needs simple majority, right? 50 plus
Yes,
1.
this is a sales tax, which needs 50% of the voters plus 1. I'd like to explain, if it's all right with you, Omar, why a sales tax is the measure that we went with. Unlike cities, counties cannot decide that they want to implement a new tax of any kind, a wealth tax, a business tax, a tourist tax. Counties only have authority granted to them by the state. And the only taxing authority we have that can impact every city in the county is the sales tax. We are able to put parcel tax measures on the ballot, but parcel taxes can only be impacting unincorporated properties, which is a very, very small number. So while a sales tax may not be ideal, it is the option, it is the only option, frankly, that is available to our county at this time.
Rosie, do you have a question? Or?
I do. Thank you, Omar. Supervisor Ellenberg, obviously we're at a time where inflation is a concern, especially to working families. It's not the ideal time, but what would you say to people who will push back and say, you know, how can you propose a sales tax increase at a time when we're dealing with inflation?
Inflation and tariffs, I mean, those are real concerns. And this is far, far from the ideal time to impose a tax. But let me say a couple of things about that. Again, the enormity of loss that we will be facing warrants a dramatic solution. Let me roll out a little bit more about how everyone is going to feel these impacts, even if they have never received a county service in their life. In addition to access to healthcare for everyone becoming more expensive and perhaps more limiting, the county is going to inevitably need to shift many millions, tens of millions of dollars from other services that we provide that are not mandated, meaning required by law. For example, there is a minimum expenditure that counties have to spend on behavioral health care. We spend hundreds of times more than that minimum requirement. We have been expanding our healthcare access, or mental health care and behavioral health care access aggressively since 2023. We have added treatment beds at multiple levels of acuity. We have added addiction services. We have added extensive outreach to people who are experiencing homelessness and serious mental illness and addiction. And it is a real fear that those services are going to be cut back. And the most pressing issues that residents will talk about when you ask them what is not going well in their community, most often they point to the significant number of people in our community who are experiencing homelessness, and particularly who are unsheltered. Our residents have told us again and again, do more, do more, do more. Without this sales tax, we're not only not going to be able to do more, but we may well be doing significantly less, and that hurts all of us.
So,
sales taxes are often referred to as regressive, meaning they have a bigger impact on people with less money. Interestingly, I tend to hear that complaint more from people who do have money. You can't do a sales tax measure, it's regressive. While that is factually true, I think if you ask people, and I hope that you will, in low-income communities, would you rather pay 5/8 of a cent more for certain items or lose access to healthcare? So the people that are most likely to be impacted by the taxes are also going to benefit from the results of those taxes. So that's an important piece. Also, sales tax does not apply to groceries, rent, childcare, education, or medical expenses. So while it is absolutely a real tax, there are many basic necessities that are exempted from the tax.
Supervisor, one observation that I had when I was reading the news, and I'm talking about Spotlight, KQ, something.
KQED.
KQED, yeah, and other media. They kind of agree it's gonna account between $1 billion to $1.4 billion. I think Spotlight say $1.4 billion, but that's annually. But the sales tax is only gonna get only $330 million. So that's a big gap to $1 billion. I mean, how is the county expecting to get the rest of the money, or like if this doesn't pass? Is the county like working in other idea, other proposal, exploring something else?
So let's talk about both options. If it passes, you're correct that it's about $330 million a year, which is a little bit less than a third of what we need. What is interesting about ballot measures when you're putting something out to the voters is that you want to have some confidence that that measure will pass. So before putting this measure out, we had some polling done, frankly, to ask people, would you invest in this? Is it important to you to save our local hospital systems and other safety net services and preserve county services? And if so, what amount of money would you approve passing? And frankly, if voters had said they would approve $10 rather than 5/8 of a cent, we would do that. So the 5/8 was really as high as our polled voters were willing to go. Another piece that people were interested in was a limitation on the tax. this tax is very much tied to the cuts of HR 1. The tax measure that is going on the ballot is just for 5 years, which gets us through, hopefully, to another administration and the beginning of the unraveling of some of these disastrous cuts. And I hope that that will make this more palatable for folks who aren't excited about a tax. Maybe there will be some energy around, okay, we're going to pull together for 5 years. We're going to do this, frankly, because the alternatives are really devastating to all of us.
Rosie?
Yes, Supervisor Ellenberg, in terms of oversight, how can the voters that we're asking to support this be assured that there will be oversight that guarantees that these funds will be used for the purposes that we are sharing? What will be in place to reassure those people in the community?
There will be a citizens oversight committee that's built into the measure that absolutely will check how that will follow how that money is being spent. What is tricky, and what I believe critics may point out is that this is a general tax, not a special tax. A special tax, which would require 2/3 of the voters to approve, would mean by law we had to spend the money on the specific things that were noted in the ballot measure. A general tax doesn't do that. So there is some undercurrent of fear that, well, we'll pass this tax and then the Board of Supervisors will decide to spend it on something else, and they won't save the healthcare system, and they won't help people who are hungry, and they won't help people who are experiencing homelessness. And to those folks, I would say, look at our track record. Look how this county spends our money. Look at the board's priorities. Look at where we have invested the money that we do have. And I think there is, I believe with all my heart, that we have demonstrated our unwavering commitment to building equity in our community, to providing more resources to the people who have fewer, and to investing in a way that makes our entire county healthier and stronger. So that's essentially the receipt, the promise that you have that we will spend this money as promised. In addition to the oversight committee, there is also an opportunity at every single board meeting to speak up, to make it known if you think that the money is not being spent properly. In a dramatic response, a supervisor could be recalled or not reelected to say, if people believe you didn't fulfill your promise, this isn't how you said you would spend the tax, you're out of here. And I think, frankly, that would be a fair response.
I think you responded my question, but I want to throw it in there anyways. And this concern has to do with the Silicon Valley Taxpayer Association. They say the county restriction for new money coming in basically is to spend it in the county. But I guess the question was asked with the oversight committee and with the explanation or your track record help you spending the money. I don't know if you want to expand on that, but I want to ask if how can taxpayers be sure that this temporary tax until 2021 won't be extended permanent? Because in politics, as far as I know, a lot of temporary things turn out to become permanent issues of permanent taxes. So how can we make sure this is 5 years and then it's going to stop?
Because by law, the tax will end. If it becomes permanent, that does happen sometimes, it will be because the voters renew it in 2030 and say, you know, you're doing a good job with this money. We want to keep providing it. It's not going to cost us any more. You've done what you said you were going to do. Maybe, God forbid, we're not out of the woods yet with Medicaid and other resources, but truly, these taxes can only continue if the voters reapprove them. Otherwise, it dies in 2030.
Awesome. That's I like to hear that because I was reading. I mean, I've been in politics,
Mhm.
reading, listening, and following a lot of politician issues. And what I see is something temporary become permanent. And I'm glad to see
Only the voters can make it permanent.
that we have to decide if we want it permanent. Rosie, do you have a question?
I do, and we were talking about the voters. Obviously, those of us that follow voting trends have been very concerned about low voter turnout.
Yes.
And as important as this is for those that will support the measure, how are you outreaching to the communities? Because we have a very short runway between now and November 4th.
We do indeed. A campaign committee has been set up. They have raised a significant amount of money, which will almost entirely be spent on messaging to voters, talking about what is at risk, why it is so critical to it's always critical to vote, in my view. But if you want to weigh in on this specific measure, you have to show up. You have to show up. You can't rely on other people to make the decisions that you would want. It is true that this will be a particularly low turnout because it comes at an unexpected time. 2025 is not when people expect to have elections. Um, Again, the special election was added to the ballot for the election of the assessor. So people will be coming out. The candidates for assessor will all be doing their best to turn out voters. Um, and it is the campaign's job, and I am working on the campaign outside of my county hours, my county business hours, to encourage support as as an individual community member.
And go ahead, Rosie.
Thank you. Can you share with us if everybody from the board of supervisors voted? Did anybody vote against it on the board of supervisors? Can you give us a breakdown of that vote?
This action actually required a unanimous vote to go on the ballot. So all 5 supervisors voted yes.
Oh, I didn't know that. Wow. I was kind of, oh, somebody's gonna be here on the spotlight. Just to clarify about some, because I'm an advocate for immigrants, especially undocumented immigrants. And what about there's a lot of things going on with ICE and all the stuff. So if immigrants go to a hospital that we are helping pay for these hospitals, I mean, are they gonna be safe? Because we concerned about the hospital, the member, the doctor, somebody call ICE. I mean, how is it gonna look like? How is the county gonna keep them accountable when we paying for that service? And if you can
So
give us some
I can
idea here.
absolutely happy to talk to that. First of all, I would again say, look at our track record. ICE is much more visible now, but unfortunately, deportations have been going on far too often for far too many years. And our county has consistently said for many, many years, we do not cooperate uh, with ICE absent a judicial warrant. And as county employees, whether they're doctors, nurses, social workers, whoever they are, don't ever ask, even our district attorney and sheriff, we do not ask about someone's immigration status. If you are in this county, you are a resident of this county, and you are entitled to the rights of any other resident in the county. And no one will be turned away from an emergency room. Again, I would emphasize that no one will ask somebody's immigration status, so no one will be turned away from emergency care. There is a really important limitation, though, that people without documentation need to be aware of. Last year, Governor Newsom expanded Medi-Cal access, that's healthcare in California access, to undocumented adults between the ages of 18 and 64. Interestingly, the demand for that was so high that I believe it surprised some folks in Sacramento. And the cost of providing that insurance was more than was anticipated. An unfortunate response to that has been to put a cap on the number of enrollees, which means undocumented adult individuals, if they are not already enrolled in Medi-Cal, may not now enroll. Further, for the folks who are enrolled, it is going to be more difficult to maintain that insurance. You should definitely connect with caseworkers or anyone you know that can provide specific information, but you will have to verify your eligibility more often, and there will be some fee associated with using the care. So again, it is just more harm to the people who can least withstand it.
So, for what I am understanding is, even though we cannot be taxed and we cannot be paying more for everything, everything of things that we buy, is not gonna include like essential things like food or milk or hospital, doctor, and I'm gonna give you the chance, Rosie. Just give me a second.
Of course.
But at the same time, we are going to save a lot of money because we can have access to Medicare, access to go to emergency room. So, if we don't have this access, or people who have access to Medicaid, if we lose that, then it's gonna be more money. You know, actually, I'm changing my job because I'm trying to get a job with medical
Right.
service. Yeah, see how it is important, but sometimes we don't listen, especially in Spanish. We don't listen the reality how this can affect us, and we believe, oh no, this is another tax, but it is. We pay a little bit more, but we getting that money back in services. Rosie, you want to add, expand?
Yes, just thank you so much, Omar. A clarifying question, Supervisor Ellenberg.
Mhm.
These changes that would bring what amounts to a premium for people who already have Medi-Cal, and also the phasing out of the availability of Medi-Cal for undocumented people who don't currently have it. Does that start in January of next year, or has it started already?
That will start in January of 2026, the Medi-Cal piece.
Very good. Thank you. Thank you for that clarification.
Absolutely.
Very good.
And to come back to just an earlier point about this tax, even if it passes, only covering about a third, you will still see cuts. They will not be as drastic, but this will not solve all of our problems. At the same time that the county has taken this action, we are also looking at our own efficiencies, trying to improve there. to streamline processes that we can, to look for additional revenue sources. We're not relying only on this tax, but it is an extremely important piece. There's no other single action we could take that could result in bringing $330 million or anything close to that each year.
I just wanna say something. So for some people, some folks who are thinking, why not taxing the rich? So the county cannot tax the rich, right? They don't have the county and the board of supervisors. They don't have the power to do that, right? Or am I wrong?
No, you are correct. Again, counties only have the taxing power that is authorized by the state. Cities have a lot more flexibility in deciding what kind of taxes they want to create. So while a sales tax is far from ideal, it is the only tool we have that can help at this magnitude.
Thank you, Supervisor Ellenberg. Do you want to do a closing statement and telling people, explaining people a little bit more about this? Can you have like spend whatever you want to spend
Yeah.
telling us? Maybe I can just do my closing too and Rosie too.
I so appreciate, Omar, you inviting me onto your podcast and allowing me some space to talk about the core services that county government provides. Again, we are the safety net. We are the often the last resort for residents in our community that need help accessing food, housing, healthcare, a whole range of services. Beyond that, we serve the entire community with our public health department, with the fact that our hospitals are, of course, open to the entire community. And we have departments that are extraordinarily highly ranked nationally in trauma services, in rehabilitation services, in burn care. We are obligated, mandated to serve the indigent, but we do not only serve them. We're also all connected, such that people who don't receive county services will still be impacted by HR1 reductions, because the services we provide for everyone, libraries, park hours, mental health services, there's so much that the county does that will be deeply, deeply impacted if we have to move dollars to backfill healthcare. I want to make clear as well that we would be responsible for funding the care of people, whether or in emergency rooms, whether or not we own hospitals. If we didn't have our own hospitals, we would still be covering the Medicaid payments to patients that receive Medicaid in our county. We would still be paying for that. And the hospitals, of course, generate revenue. So the fact that we have the hospitals means that we are also generating revenue in our county. The HR1 just threw that balance entirely out of where it should be, and has made our system much less stable than it otherwise would be. So I encourage, in my county supervisor role and during the day and through my office resources, my job is to educate and to explain what the losses are, what is at risk, and how the county is trying to mitigate those losses. Outside of my county official role as Susan, as someone who very, very much cares about the well-being of all of our residents, I can also be an advocate as well as an educator. And my advocacy self very, very much hopes that voters turn out in large numbers, that they vote to save our local hospitals, and that they tell their friends and community members to do the same thing.
Something.
Thank you, Supervisor Ellenberg. I had a question for those of us, those that will tune in. Where can you access more information about this measure? If we could share that with the community. Will there be information that they could access in other languages, Spanish, Vietnamese? Anyone listening, and I don't know if we have a way of putting it on the screen, or certainly if you could share that with us verbally.
I will, there are two different ways to access information. If you want campaign information, how to support the campaign, how to have somebody come and speak to your community about it, I believe that is saveourlocalhospitals.com. And if it's not live yet, it will be within a day or so, saveourlocalhospitals.com. If you want educational information, data, statistics, the county also has a website, and I have to get you that information. So maybe, Omar, by the time this is airing, I will be able to share that website with you too. I just don't have it offhand. I apologize.
Okay, no, that's fine. I can include it on the comments, on the first comments there, and
Thank
just
you.
stay there.
Thank you.
On the Save Our Local Hospital, something that I read there, he says that we already running the accounting for with like for the hospitals with a short budget of like over $300 million. So this will include another $1 billion short. I mean, that's and
Yes.
then 2 years ago, I remember I interviewed Supervisor very young when she was candidate, running for candidate. Then I interviewed her when she was elected supervisor.
Mhm.
And I questioned her about the hospital. How can the county is not doing anything about the hospital? And then she told me, great news, Omar, we are going to buy. I was like, oops, sorry, I didn't know that, but she was already working. So, and that was surprising for me. And at the same time, made me feel proud that to see the county is moving forward on issues that really matter for us. I also have to say something. You literally become my hero when you became the dissident vote when decided about ICE to work with the police county, and all the supervisors kind of voted for yes, and you were the only one who voted against it. And then that changed the whole picture because in the next vote, everybody voted against it. And I was like, whoa, thank you.
Thank you for that.
Thank you for that.
I didn't realize that I was going to stand alone. I was the first person to speak and to vote on that. And I remain to this day very proud of that vote, even though I stood alone. You asked about
a little story about Supervisor Ellenberg during the pandemic, when nurses were literally risking their lives in the front lines of the pandemic. It was still dark out, very dark in Gilroy, and Supervisor Ellenberg decides to, come out from where she lives while it was still very dark because she wanted to be there when the nurses that showed up for the very earliest shift. She brought coffee and bagels and donuts. And this was away from cameras, away from, any glare of the public. But it was a way to very privately say to the nurses, thank you for all that you do. And I have to say, as an RN, Supervisor Ellenberg, that moment for me was very special in telling me and showing me the person that you are and the great care and concern that you have for our first responders, for our nurses, for all of those that are risking their lives in the front lines of all these healthcare issues, and the others that might come. We have a head of Health and Human Services that is denying the efficacy and the safety of vaccines. I'm very concerned that if we don't invest to shore up our line of defense health-wise, we're going to be looking at other challenges. So as a nurse, I really hope that we do our best to support our local hospitals.
Thank you. We have already lost $20 million in public health contracts. Most of our public health work is done through federal contracts, and we are anticipating losing even more. It is one thing to be values aligned, and it is another to not have the money to live those values, which again is just another critical reason to support this tax measure. Omar, you mentioned a few minutes ago the $300 million, I think you called it a deficit, but I'm going to describe it differently to explain what that is. The county does invest, while the hospitals generate revenue, the Valley Health, our original Valley Medical Center, was coming very, very close to being self-sustaining. We were down to under $70 million of a subsidy, general fund subsidy, which is also an investment. That number bumped back up again when we bought St. Louis and O'Connor. We expected that to level off after a year or two, and then we had COVID, and we spent extraordinary hundreds of millions of dollars having some of the best prevention and response work in the entire country, but that kept us from coming back to a place where we would be less reliant on county general fund. We were able to purchase regional medical center with some of the funds that were reimbursed from the COVID expenditure. So again, investing money, not going into debt, really doing what we can manage. But it's likely that investment or subsidy will have to continue for another several years. But everyone at the county is very aware of that and very focused on getting the hospitals to be a true enterprise system that don't require that additional investment. Some of that investment, interestingly, is really just to pay it forward. Medicaid reimbursements often come 12, 18 months after the expenditure was made, which also makes Medicaid very unappealing to private for-profit hospitals. We are able to wait that 12 to 18 months because we have this general fund source that we can put in essentially to backfill. So in some ways, we're putting the same money back in year after year, not necessarily cumulative.
That's good to know. I mean, we don't realize how devastating was the pandemic for all our county. A lot of people say, "Oh, the county is spending too much money on this," or the city is spending. Our politicians, because sometimes in their mind they think our government is for profit. Our government is not for profit. It's to give us back the service, and services, the money we pay. People, they don't know about it.
Yeah, and when we are spending money on the community. We are spending money to provide resources, to provide care, to provide treatment, to provide food, to provide safe homes for children. This money that comes in from all of our sources, federal government, state government, property taxes, some sales tax already, that money goes back into the community to fulfill our mission. We don't do this for ourselves. And it's interesting that I heard a comment or read a comment of someone who was opposing the sales tax and said, well, this sucks for the county, but why am I going to worry about it? As if the county retains all of the money and doesn't impact anyone else. There are a lot of misunderstandings. On the other hand, county government is extraordinarily complex So I'm 7.5 years in and literally still learning every day.
Thank you.
Supervisor Ellenberg. Go ahead, Omar. I'm sorry.
Promise you, this is my last question, and I have to
Okay.
ask you. This vote where you became the dissident voter, there was to mingle police and ICE in the county.
Mhm.
You began with San Ricardo letter, sending San Ricardo letter to the county before you got elected. I know because I was there protesting, trying to convince now Senator Cortese to vote against it, but Senator Cortese pulled it out and put it on hold, and that's why it came back later. My question would be is like if another proposal comes to you on your table, like similar to, oh, let's say Sam Ricardo, and say, please, ICE work with the police. Would you vote? How would you vote looks like?
Never. Local government is not in the business of distinguishing between its residents based on immigration status. It's irrelevant. It will not be, as long as I'm on the board and have some influence, should never be part of our consideration.
Thank you very much. And
Got it.
Rosie, last words before we do the closing?
Last words before my friend. You know, I have a friend whose husband was on a drive with their son, and they were chatting. In the middle of the conversation, the father had a blank stare. He was looking ahead, and the son knew there was something wrong. And turns out that the father was having a stroke while they were on this road trip. And so I don't mean to be an alarmist, but as a healthcare provider, I can share with you that we are, many of us, at high risk to have a heart attack, to have a stroke. Having a healthy hospital system, whether or not you have insurance or not, you don't know where a loved one or yourself will have that stroke, will have that heart attack. A stroke requires immediate care, and every second counts. If wait times are increased, if our local hospital is not supported to maintain the best qualified staff and the best processes, you, your husband, a loved one can be that person who has a stroke, who has a heart attack, a medical emergency. We should all be deeply concerned and passionately supportive of maintaining a hospital system that will be there when we need it. So that's just what I want to close with as a nurse.
Thank you, Rosie. And I have to say, 2020, during the pandemic, we voted to keep Caltrain Rail running empty for a whole year because of the pandemic. And we voted to tax to keep empty running Caltrain. I think that was not a good idea. Some people thought it was a good idea. Majority of San Jose people say, of Santa Clara say it was a good idea. But if we voted to keep the train running empty for a whole year, I mean, this is way more important because this affects our health. And the good thing, it doesn't discriminate nobody. If you voted for Donald Trump or you don't vote for Donald Trump or you don't vote at all, you will get the health care. Nobody's going to ask you, are you legal and documented? Are you pro-Trump, against Trump, whatever? You are going to receive a service 100% or whatever we can get, the best that we can get, I would say. And I have to say thank you, Supervisor, for this proposal. I was kind of concerned, I have to say. I was kind of like, let's see how it looks. But thank you. You really convinced me. I mean, I have to say, I was more towards yes, but now I feel like, yes, it has to be yes.
I'm so glad. Omar, Claudia, thank you both so much for the conversation, for the thoughtful questions, and for this opportunity to reach your community. I really appreciate you.
Thank you. Gracias. Hasta luego.
Hasta luego.
Supervisor, have a good day.
You too.